Hey everyone, and welcome. As surgical assistants, we are absolute experts at stabilizing patients physically in the trauma bay. But what if we could take that skill and expand it to help heal the whole person? Today, we're going to dive into a really practical, humanistic approach that doesn't just transform patient outcomes, it also supports the well-being of you and your entire team. So let's start with the end goal. This quote right here, this is it. It comes from a patient and it really captures the entire spirit of what we're talking about today. It's about moving beyond just fixing an injury. It's about making sure that every patient feels seen, heard, and truly valued through what is likely one of the worst days of their life. So the big question is, how do we make this feeling the standard? Not the exception. Well, the key is really getting a handle on the principles we're about to cover. And that's where you come in. Your role as a surgical assistant, right there in the thick of it, is just so critical to making this a reality for every single patient who comes through those doors. All right, so here's our roadmap for today. First, we'll talk about what a more humanistic approach even means. Then, we'll get into understanding the whole patient, not just their injuries. After that, we'll give you a practical toolkit you can actually use, and we'll focus on compassionate communication. And then, really importantly, we'll talk about why this all matters for you, and we'll wrap up with your unique role in the healing process. Okay, let's dive right in. This humanistic, or what we call a trauma-informed approach, it's all built on one simple but honestly profound idea. Our patients have lived entire lives before they get to us. They are full of experiences, and all of that shapes how they react to this new, and let's face it, often terrifying event. Just think about it for a second. A patient's past trauma, and that could be physical, emotional, or social, it doesn't just vanish when they arrive. It's right there with them, and it directly impacts their behavior. So what we might see as someone being difficult or non-compliant, well, that could actually be a deeply ingrained survival response to feeling a total loss of control, or maybe a fear of authority from a bad experience in the past. So, to really understand the person in front of us, we have to look beyond the immediate injuries. This next part gives us two concepts that act like a wider lens for us to see through: social determinants of health and the real impact of prior traumatic stress. Social determinants of health, you'll hear it called SDOH. These are the real-world factors that shape people's lives. And this is not about individual choices. It's about the big picture, the systems and environments that can actually increase someone's risk of getting injured in the first place, and then throw up huge barriers to them getting better. Now, what's so important to get here is that these 5 things don't just exist on their own. The source material calls it a synergistic effect, which is a fancy way of saying these challenges multiply. They don't just add up. Think about it. A patient with a broken leg who also works an hourly job with no sick pay and lives in a third-floor walk-up apartment, they are facing way bigger hurdles to recovery than someone with just one of those problems. Okay, let's get practical. This is the toolkit you can actually use every single shift. It's called Trauma-Informed Care, or TIC. Now, this isn't some extra checklist you have to do. Think of it more as a framework, a new lens to look through that guides every single thing you do to be more holistic. And this is key, to avoid accidentally re-traumatizing a patient. You can break down the basics of TIC into what's called the 4 Rs. First, we have to realize just how common trauma really is. Second, we learn to recognize the signs, not just in patients, but in their families and even in ourselves. Third, we respond, not just on our own, but by building this awareness into how our team works. And finally, we actively work to resist re-traumatization. And these 6 principles, this is how we bring those 4 Rs to life. We create safety, not just physically, but psychologically. Trustworthiness and transparency are huge because they cut down the fear of the unknown. We work through collaboration because healing is a partnership. It's not something we do to a patient. But honestly, the most important one might be empowerment, voice, and choice. Because trauma literally strips away a person's control, and our job is to help give some of that back, even in the smallest ways. All right, now we get to what might be the most critical part of your day-to-day practice. All those big ideas and principles, they become real in the way we communicate. Your words, your tone, your actions, especially in a high-stress trauma bay, can either build trust or they can ramp up fear. I mean, look at the contrast here. It really is everything. On one side, you have simple things: a calm voice, eye contact, actually listening. On the other side, you have actions that pour gasoline on the fire: shouting, judging, sarcasm. Just remember, your body language and your tone are as powerful as any tool you use. You can bring the temperature of a whole room down just by how you carry yourself. This is just a perfect example of empowering communication. This simple sentence does so much. It gives the patient one single thing to focus on in a chaotic room. It's totally transparent about what's going on, and it gives them back a little bit of predictability and control. It builds trust, instantly. Now, let's contrast that with this phrase. The person saying this probably means well, they're just trying to get control. But the impact? It can be awful. It completely dismisses the patient's very real fear. It takes away all their agency, and honestly, it can feel like a threat. This is exactly the kind of communication that can re-traumatize someone and frankly, make our jobs a lot harder. Now, let's shift gears a little and talk about how all of this directly benefits you and your colleagues. It's so easy to hear this and think, great, one more thing I have to do. But the reality is, thinking this way is actually a powerful form of self-preservation in what we all know is a really demanding field. Let's be real. The high-stress, high-stakes world of trauma care takes a toll on us. This approach isn't just about the patient. It's a tool for managing the intense pressures that the whole team faces. It actually helps create a healthier, more sustainable place for all of us to work. And the evidence on this is pretty clear. When healthcare systems adopt these practices, people report higher job satisfaction and a real drop in burnout. It helps protect us from that secondary and vicarious trauma that just comes with seeing so much suffering day in and day out. It builds a culture where we have each other's backs, and it keeps us connected to why we all got into this work in the first place. So let's pull all of this together. As a surgical assistant, you are not just performing tasks on a checklist. You are a central figure in what might be the most pivotal moment of someone's life. You have this incredible opportunity to contribute not just to their physical survival, but to their long-term psychological healing. So if you take anything away from this, let it be these key points. First, those social determinants of health are a clinical reality we have to deal with. Second, remember the 4 R's of trauma-informed care. Third, treat compassionate communication like the critical clinical skill that it is. And finally, know that this approach is a total win-win. It's better for the patient and it protects you and your well-being. And we'll end with this question for you to think about. This isn't about changing everything overnight. It's about small, deliberate actions. Maybe it's just making sure you introduce yourself to the patient. Maybe it's narrating what you're doing as you do it. Or maybe it's as simple as taking one deep breath before you walk into that room. What is the one small change you can make? Because that's where the real transformation begins. Thanks for listening.